At this point, we'll ask Terri to come up and describe some of her experience with some of the workplaces that have done it.
Yeah, and I'm going to start with the tool that we just handed out because I'm going to talk a little bit about just what we've learned through our practicing and working on this issue. As every workplace is different, so that these tools are adaptable. The very tool that we just handed out, which we nickname the self-scoring, which you can hand out or people can do. We hand out the self-scoring in very small departments with less than 15 people. Like a health and safety rep has handed them out, had their department fill them out. They shuffle them up, which makes them anonymous. And we've had health and safety reps bring the 15 forms and say, look, this issue was the biggest issue for all of our people, and we recommend A, B, or C. So we've had workplace change occur just from using the self-scoring that we just gave out today. Our MIT kit also sends you to the Sobane tools from Europe, where they have committee checklists where committees or focus groups can sit and take themselves through all of these psychosocial hazards about how does our organization respond to this? How does our organization deal with this? So there are, and when we did the app, we encourage people in the app to go and develop some sort of collective solution together. And so these are adaptable tools. That's what we're learning. It's not every time that a workplace has to go and do the survey monkey survey with their whole building. There's times we do 2 departments in a workplace and make change in particular departments. I have a department in a hospital that did it, run by the champion was our Joint Health and Safety OPSU member who did the survey. She did it, handed it out and did it herself, and handed out, collected it, shuffled them up, came out with work demands, found like about 15 items in the tasks that weren't being tracked as part of the official work demands. So she's seeking change in her workplace to say, hey, it's not just time on the table in an ultrasound and lab that matters. It's helping people fill out forms. It's like interpreting people with trying to fill out forms from other languages. It's what workplace changes can we make to make this place better. So they're making change with all kinds of different tools, not just the big survey. So I want to just tell you that in the learning journey, when we started in 2009, the health and safety reps were being told, this is not a health and safety issue for the Joint Health and Safety Committee. We've moved from that to 2015 or 16 and 17 to the response, oh, we already have an engagement survey. So we've moved the bar ahead. Now what we need to do is say that it's more than just about the employer goalposts, the organizational goalposts, which are the engagement survey, and to the extent that there's a commonality between the worker goalposts and the organizational goalposts about what we will attend to, it's when everyone in a workplace is looking at everyone's goalposts, the organizational goalposts and the worker goalposts, and making the engagement survey more than that, and getting at some of these primary prevention aspects of organizational factors that we're going to make change. In our using of all of these tools in our OPSU membership, we've come across 2 approaches. The ideal one, the one we want, is the cooperative approach, where workers and organizations get together, roll up their sleeves and say, let's figure out what's going on here and let's fix it. And we've got collective agreement language in the OPS in a couple of ministries to create province-wide occupational stress committees. And so we're working on the cooperative approach with some really good employers who want to take action on this issue. One thing I've discovered about the cooperative approach, though, is it requires us to go through the learning journey that it's more than just tertiary preventions. Because even in the cooperative approach, like I drop a pen and it drops to the floor, in the cooperative approach, employers, and it's a Canada approach, I can't blame just employers for it, Canada's approach is to go to, how can I help, what do I do to get the person to interact better with my organization? What supports can I bring to the individual? It's not that they're looking at, what can I do to make my organization supplement all those efforts that the individual is bringing and that I'm providing for the individual. So even in the cooperative approach, we have to move our employers that have signed on to this process, to this, I lovingly call the diagram that John showed you the tic-tac-toe table. Organization, individual, primary, secondary, tertiary. An organization that's doing a full comprehensive approach to mental health is going to have interventions in every area. And they're not just going to think that the ones on the individual side are enough. They're not going to think that waiting for the tertiary is enough. They're going to say, and this is what we're trying to lead our work with our ministries on. We've got a couple of ministries with these stress committees looking at the tic-tac-toe table going, okay, I have that, I have something here, I have this here, I have this here, I have this here. Then they'll say that they're, doing the most that they can. The crisis approach is the other approach. That's the approach that happens when someone either finds themselves in court with a case. If you've read the CBC investigation report from Jean Ghomeshi scandal, you'll have heard about the Red Sky document, which was a document that was drafted by workers 2 years prior to the scandal, where workers had identified in very constructive, positive language the issues that were going on in their workplace and their recommendations for prevention. And the investigator said that the employer got that document and made a few small changes, but in the investigator's view, didn't make the changes to the satisfaction of addressing the problem. The crisis approach is not where you want to be. It's where we end up being. I mean, I get calls from workers in workplaces where they're toxic workplaces. We've started and done the survey in the toxic workplaces. One example in community nursing that turned into a cooperative approach, because when we brought the results to the employer, we collaborated with them, and our local arranged a whole new way of dispatching the calls that reduce the workload, that reduce the stress, that reduce the emotional demands, that reduce the bullying and harassment. So you can have a crisis approach that ends up in a cooperative approach. But the ideal thing is to have a cooperative approach, to work together. The workers know what the issues are, and that's why we adopted the learn, organize model that John outlined at the very beginning, because we need to adopt collaboration into the model. And we weren't sure that Plan, Do, Check, Act specifically specified that there needs to be involvement of everyone in collaboration, although I know the intention is there for it. We just want to stress that that's how change happens. That's how change happened in our view. When we offered the survey to 55 bargaining units, we didn't get a good response rate in the ones that it wasn't a burning issue for. So that tells you the importance of commitment to this issue, not just for workers, but for employers. And we're hearing about leadership commitment all the time. So it's when you have commitment and you want to do something about it, and you look at and you go through the learn, educate, and you figure out what is the approach to this thing, and developing a varied and a comprehensive approach, that's when you'll find success. And so we keep working, our locals are using a variety of methods, workplaces are doing a variety of things, and we're hoping that it moves forward, and that this whole idea of the tic-tac-toe table kind of as a range of comprehensive interventions takes off better, and that we get more change, and that we meet Mr. Flynn's commitment and desire to have all workplaces in Ontario be psychologically safe and healthy.
And I'd also like to ask Ken Rayner. Pardon? Oh, there he is. I thought you were sitting there. Okay. The IHSA has done the survey twice, and so I asked Ken to talk about his experience.
Great. Thank you very much. You've had a bevy of mental health experts talk to you today. It stops now. So hopefully that's not going to have a whole host of people drop off online. For the people in the room, I can see if you're leaving. So so why am I here to talk to you today? I think John invited me to speak to you about the relevance of all this from, I think, a layperson's perspective. So I'm part of the executive management at the Infrastructure Health and Safety Association. And in 2015, we were in the throngs of having our health and safety management system certified. About that same time, May of 2015, I had the pleasure of attending a presentation put on by John at the federal open house, federal labor program open house that we were hosting. And it struck me, and those from IHSA that were also in attendance, that what we were building and moving towards having certified in our health and safety management system had everything to do with controlling the physical hazards, but had very little to do with addressing or even identifying what was the state of the mental health of our employees. So we spoke with John and Val, and they were both very receptive to coming in and presenting an opportunity to assist to our Joint Health and Safety Committee. The executive management was very much behind it because we didn't know what the state of our mental health environment was at IHSA. And John, correct me if I'm wrong, I believe although it had been done in many cases through unions, we were one of the first employers in Ontario that undertook your help to conduct the survey. So our first survey that we undertook was in January of 2016. And when John showed you the graph that had, blue was sort of the best, you're outperforming, green was better than, and then yellow and orange and red were not good indicators. When we got the survey back, we had more orange and yellow than we had green and blue, which as a health and safety association was not an easy pill to swallow. But at least now we had the information of where we were at, and we had a good roadmap of what we needed to do to correct some of the issues. And so what I can tell you in 2016, again with the help of John and very much in conjunction with our Joint Health and Safety Committee, we put together a plan to start addressing some of the issues that had been uncovered. And we wouldn't have known about it if we hadn't used the survey. We would not have a clue. If we had just embarked on an initiative to improve mental health in our workplace, without that clear roadmap, I don't know where we would have started. The good news is that we conducted a follow-up survey this past January. And John, I think you'll back what I'm saying here, is that we made significant progress. The good news was in the original survey, our employees stated that the work that they felt they conducted, that what they did at work was very meaningful. But there was other issues. So that was a good start. At least we knew that people were employed at IHSA and felt good about the work they were doing. Perhaps how they were doing it or the environment in which it was being conducted was what we needed to improve. So that's what we embarked on. And our journey is not over. We will continue to use the survey at John's advice and guidance in terms of intervals in the future, whether we assess January 2018 or wait another year to see more progress and perhaps wait till January 2019. But it is evident that we have to continue on this path. And so here's a few things that I would encourage any employer or anybody in this room to perhaps undertake or think about doing. Number one, consider using the survey. It's one of those things where it's like navigating water where you know there's an iceberg. Do you just want to say, I'm going to pretend it's not there? Or are you going to say, you know what, we know it's there. We just don't know what to do about it. The survey is a wonderful tool for helping guide your decisions and raise awareness as to what some of the issues are in your workplace. Once that's done, there's a lot of system partners here today that are experts in this field. IHSA is not an expert in mental health. That's why we turn to our system partners like OCAL and WSPS and PSHSA to assist us, not only to help us as employers, to help our employees, but also down the road to be able to help the industries that we support so that we can, once we've become more acquainted with creating a good work environment for ourselves, then we're going to feel more comfortable about going out to the workplaces that we support and providing some guidance as to what should be done. So one of the mandates we have, and I know training is only awareness, but one of the mandates we have this year is that every manager at IHSA is going to take WSPS's mental health first aid training. And that's, again, going to raise awareness and make our managers more acutely aware of what needs to be done in terms of moving towards a change to the workplace culture. Because that's ultimately our goal, is to correct that from a primary perspective. Okay? Thank you, John.